Hello everyone, my name is Ryan Garza. This video covers the cranial nerves involved in the pharynx and larynx. Let's get started. Swallowing, or deglutition, is a remarkably coordinated process involving a series of muscles and actions. First is soft palate elevation. As food is swallowed, the soft palate elevates to seal off the nasopharynx, preventing food from entering the nasal cavity. This action is orchestrated by muscles innervated by the maxillary division, the V3 branch of cranial nerve 5, the trigeminal nerve. Next is pharynx and larynx elevation. Longitudinal pharyngeal muscles, which are the palatopharyngeal, the salpingopharyngeal, and the stylopharyngeal muscles, elevate the pharynx and larynx, aiding in the swallowing process. These muscles are innervated by cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus. These muscles are also very important for speaking. Then is epiglottis closure. The epiglottis closes over the larynx, preventing food from entering the airway. These muscles are innervated again by cranial nerve 10. Finally are the pharyngeal constrictor muscles. The superior, middle, and inferior pharyngeal constrictor muscles contract, propelling food downward through the pharynx. These muscles are innervated by cranial nerve 10. Finally, and importantly, is the gag reflex. All previously mentioned muscles, except the stylopharyngeal muscle, are innervated or involved in the gag reflex. These muscles are innervated by cranial nerve 9 and cranial nerve 10. Now, I'll move on to the larynx. The intrinsic muscles of the larynx are innervated by branches of cranial nerve 10. These muscles are responsible for altering the length and tension of the vocal cords, the size and shape of the rima epiglottis during phonation. The recurrent laryngeal nerve innervates the posterior and lateral cricoarytenoid muscles, the transverse and oblique arytenoid muscles, and the thyroarytenoid muscles, as well as the vocalis muscles. The external laryngeal nerve innervates the cricothyroid muscle. Again, both the recurrent laryngeal nerve and the external laryngeal nerve are branches of the vagus nerve. I'd like to mention here that the accessory nerve, cranial nerve 11, indirectly influences the larynx during swallowing through its control over the sternocleidomastoid and the trapezius muscles, which may influence the position and stabilization of the larynx during the swallowing and phonation. And that wraps up my overview of the cranial nerves that innervate the pharynx and larynx. I'll leave my colleagues with a question. In a patient presenting with a diminished gag reflex, which specific muscles dysfunction can be automatically ruled out as the cause of the diminished reflex? Thank you.